Hello friends, welcome to another anatomy video, and today we'll be discussing the joints found in the axial skeleton. In my last two videos we went over the joints found in the superior and inferior limbs, but today we'll start off with the joints found in the head. Within the head there are cranial sutures. In fact, there are 33 named sutures found in the skull. Although there are 33 sutures named in the skull, we're only going to name a handful of them, starting with the one on the frontal bone. This suture is called the frontal suture, since it's found on the frontal bone. The frontal suture is unique because as the bone matures, it actually ossifies the frontal suture, making it therefore no longer a joint, it's just bony tissue. However, in some individuals, the frontal suture persists, and if an individual has the frontal suture after the age of 6, this suture is then called the metopic suture. Again, just to review that, this is called the frontal suture up until the age of 6. If an individual has this suture at the age of 6, then it's called the metopic suture. The next suture I want to point out is called the coronal suture. And that suture is located here. The next suture we're going to learn is called the sagittal suture because it more or less goes down the mid-sagittal plane. After the sagittal suture, we have to go down to the posterior aspect of the skull, where we can see the next set of sutures that we need to identify. Again, we can see the sagittal suture coming down in this direction, as well as the coronal suture going down laterally. Which then leads us to this suture found by the occipital bone. This suture, which creates a division between the occipital bone and the parietal bones, is called the lambdoid suture. The next suture creates a division between the parietal bones and the temporal bones, and this is going to be called the squamous suture. And those are all the sutures that we need to learn that are found in the skull. Like I said earlier, there are 33 named sutures found in the skull, but for gross anatomy, all we need to learn are those 6. However, there's one more landmark that I need to identify. Right here, looking at the posterior view of the skull, it's pretty easy to see the lambdoid suture coming up and dividing between the parietal bones and the occipital bone. However, you can see that this suture doesn't form a perfect line. It actually forms like a ring right here around this area and also right down here. These little patches are called sutural bones. And all they are is that the suture goes up and around them and doesn't form a perfect line like some of the models that we have do. So these are both called sutural bones. They don't have any specific name besides sutural bones. Okay, so if you see the suture kind of go down and then form this little patch or a little circle, that right there is going to be the sutural bone. And they're typically found by the lambdoid suture, but they do occasionally show up in other parts of the skull. Now we can go ahead and move on to the next set of joints. The next set of joints that I'm going to mention are all synovial joints, and we're all done identifying the sutures. The first joint I want to mention is found right here between the condyles of the occipital bone and the superior articular surface of the atlas. This joint is called the atlanto-occipital joint. Its classification is a condylar joint. The next set of joints that I want to identify are found between the axis and the atlas. I'm going to go ahead and switch images so I have a clearer view of both of these bones. The first joint I want to identify between these two bones is located between the dens of the axis and the anterior arch of the atlas. This joint right here is called the median atlantal axial joint. And this joint's classification is a pivot joint or trochoid joint. This joint is occasionally called the no joint, because as the joint pivots from left to right, it does the no motion. The next joint found between these two bones is located right here between the superior articular processes of the atlas and the lateral masses of the atlas. These joints are called the lateral atlantal axial joints. And the classification for these joints is planar joints. Let's go to the other image so we have a better view of these joints. Here's one joint right here, and on the contralateral side, it's located right here. Again, these are called the lateral atlantal axial joints. When I mentioned earlier that the median atlantal axial joint is called occasionally the no joint, it reminded me that there's such thing as a yes joint. The atlantal occipital joint is that joint. It's occasionally called the yes joint. The reason for this is because as there's movement between this joint, it rocks anterior to posterior, nodding a yes. So that's why it's called the yes joint. Now let's go ahead and move on to the next set of joints. In one of my past videos, I already mentioned the name of this joint, but I'm going to go ahead and do it anyway. This joint right here between the mandible and the temporal bone is called the temporal mandibular joint. The joint's classification is going to be the bicondylar joint. A unique characteristic about this joint is that it has an articular disc. And now we've mentioned all the joints that have articular discs. Let me remind you of the trick is going to be STAR, and it's going to stand for sternoclavicular joint, temporal mandibular joint, acromioclavicular joint, and the last one is radiocarpal joint. And all those together have articular discs. Moving on, we can see the next set of joints that we need to learn. Down the mid-sagittal plane on the mandible, there's a joint here called the mandibular symphysis. The name of this joint is quite misleading because there's no actual joint located here. Through synostosis, a union was created and connected these two parts of the mandible with bony tissue. Because of that, there's no actual joint here. Yet the name persists and it's called mandibular symphysis. The next joints I want to identify are the joints of the teeth, both on the mandible and on the maxilla. These joints are called gumphoses. And that's all you need to know for the joints of the teeth. They're all called gumphoses, no matter if they're articulating with the mandible or with the maxilla. The joints are called gumphoses. And those are all the joints located within the head. We can go ahead and move on to the vertebral column. Right here we have two vertebrae, and each vertebrae has a significant amount of synovial joints articulating with them. The first set of joints that I want to show you are located between the superior and the inferior articular processes of a vertebrae. Located here, and here, and here, and here, and here, and on the other side as well. These joints form between this inferior and then the superior of another vertebrae. This is going to be called the zygapophyseal joint. The classification for this joint is a planar joint. So if you look at it carefully, each vertebra has 4 zygapophyseal joints, 2 on top and 2 on the bottom, each one being formed again by the superior and inferior articular processes. The next joint, found between 2 vertebrae, is located right here. This joint, found between the bodies of the vertebrae, is called an intervertebral symphysis. The classification for an intervertebral symphysis is just a symphysis, which, if we remember, is a subclassification underneath cartilaginous joints. All symphysis means it's made of a fibrocartilage. Now, the disc that makes the intervertebral symphysis is called an intervertebral disc. So this joint component right here that makes up the intervertebral symphysis, that joint component, again, is called an intervertebral disc. And the intervertebral disc is made up by 2 different parts. Right here we can see the intervertebral disc without the vertebral body above it. So again, this is the intervertebral disc. However, it's made up by 2 parts. The section highlighted in green is called annulus fibrosus. Of an intervertebral disc. The word annulus might sound familiar because we learned a region called digitus annularis, which meant ring finger. So right here we have a fibrous ring that's part of the intervertebral disc. The second part of an intervertebral disc is located here in the center. It's very gelatinous, and it's called the nucleus pulposus. Of an intervertebral disc. And those are the 2 different parts of an intervertebral disc. And the intervertebral disc, remember, is a joint component of an intervertebral symphysis. Continuing on with joints located on vertebrae, we have joints between vertebrae and the ribs. The thoracic vertebrae have joints between the ribs and the transverse processes. These joints are called costotransverse joints. Their classification is planar joints. Another set of joints found within the thoracic vertebrae and ribs are located here. And the names of these joints are very complex, so you're going to have to pay attention to how they're spelled out. These joints are called joints of a head of a rib. Again, the name of these joints are very complex. The classification for these joints are also planar joints. And the last set of joints found within the vertebral column is located here. Between the 5th lumbar joint and the bony sacrum, we have the lumbosacral joint. And its classification is a symphysis. This joint does also include an intervertebral disc as its component. The next joint that we can identify in this image is between the bony sacrum and the coccyx. This is called the sacrococcygeal joint. The classification for this joint is also a symphysis, but typically it becomes synostotic and is fused by bony tissue. But before then, it is a symphysis. We can now return back to the thoracic cage. We already named some joints that are found on the ribs, but those are found on the posterior aspect of the thoracic cage. We have to identify the joints found on the anterior aspect. The joints located between the ribs and the costal cartilages, indicated here in this red color. These joints are called costal-chondral joints. And their classification is synchondrosis. Because these joints are formed by hyaline cartilage. If we continue to make our way more anteriorly, there's a joint between the costal cartilages and the sternum. These joints, again made by the costal cartilages in the sternum, are called sternocostal joints. And these joints are synovial joints, and they are planar. You may have noticed that while I was labeling all the different sternocostal joints, that I forgot to label the ones of the first ribs right here. I did it on purpose because I wanted to make a special note about them. These are still sternocostal joints. The names are the same as the ones located inferior to them. However, their classification is different than those underneath them. While the rest are synovial planar joints, the joints between the first ribs and the sternum are synchondroses. Again, the reason being that these joints are made up of hyaline cartilage. Again, all the joints found between the costal cartilages in the sternum are called sternocostal joints. The joints found between the first ribs in the sternum are classified as synchondroses, and the ones found inferior to them are all planar joints. The last joints found between ribs are actually located between the costal cartilages. There's one right here, there's one right here. It's pretty much where all the costal cartilages are united. These are called interchondral joints. And their classification is planar joints, meaning that they're synovial joints. Awesome, and those are all the joints found within the ribs. The last joints found within the axial skeleton are located here on the sternum. We already know the names of the joints that articulate with the sternum, such as the sternoclavicular joint, as well as the sternocostal joints. However, there are joints found within the bone itself. You can see this line found here between the manubrium of the sternum and the body of the sternum. This joint is called manubriosternal symphysis. The classification for this joint is symphysis. The joint located between the body of the sternum and the xiphoid process of the sternum is called the xiphosternal synchondrosis. The classification for this joint is synchondrosis. Remembering the names of these joints can be difficult because they both have an S for the second part of the name. The first joint being the manubriosternal symphysis and the xiphosternal synchondrosis. The way I remember these two joints so I don't get them confused is that in heaven there are angels playing in symphonies, and in hell that's where the sinners go. So symphysis is in the superior part of the sternum, and then down below, inferiorly, is where the synchondroses are. So that's how I remember these two. This may not be helpful to you, but it's helpful for me. Manubriosternal symphysis is between the manubrium of the sternum and the body of the sternum, and then the xiphosternal synchondrosis is between the body of the sternum and the xiphoid process of the sternum. And that's it. Those are all the different joints located in the axial skeleton. Again, I hope this video was helpful, and I hope you guys have a great day. Take care.